So, I mean, on the issue of mental health,
Yeah.
and obviously, we've all heard people speaking. They're clearly traumatized.
Yes.
They need that support.
Yeah.
Are you the first point of contact when they're seeking it, and are you able to kind of get quick referrals? Because
Yes.
in the normal scheme of things, a
Correct.
referral takes a long time.
Yeah, no, you're quite right. Under usual circumstances, sadly, because the service is at capacity, people often wait. But the primary mental health team here have done such a lovely job. And actually, there's a 24-hour telephone line. I don't know if you're allowed to show it at the end, but there's so you're always welcome to come see the GP. There's also a single point of entry access to mental health care. So that support's on hand. But I probably would just, again, want to share with people that I think there's a risk to make pathological what is actually normal sometimes. So when you're faced with this degree of catastrophe, to have bad dreams about it in the short term, for the immediate weeks after it, to have palpitations, to have a sense of panic, to grieve, to bereave, all of these are a normal spectrum of emotions to have in relation to that event. And I would definitely encourage people to see their GP and to speak to the mental health care unit. But for most people, the initial actual involvement or their care will be what we call watchful waiting, where you offer support, you offer empathy, you witness their grief, you be part of that, but a large number of these actually will resolve by themselves. It's more individuals, for example, that are high risk of post-traumatic stress disorder. So if you had a pre-existing mental health condition, if you've had experience in the past of tragedy, this group of people really are very high risk for having a prolonged or unusual response to this set of circumstances. So those are the ones as well where we try to involve secondary care or specialists quite early on.